Hey class, sorry I missed you guys today. My allergies were really bad. Pollen count apparently is high, so this morning I got up. It was like nonstop sneezing and eyes running and some wheezing as well, so I figured I'd stay home today. So I know didn't have class, but in lieu of having class, I created this little video, less than 15 minutes, of some content that I would have discussed this morning with you. I'll follow up this YouTube video with the resources that I'll email everyone, or I'll post on Advanced 360 for you so you can have access to this content as well. And when we meet on Thursday, I'm hoping everyone's had an opportunity to view this, understand the components. So on Thursday when we meet, we can do a little playing with some scenarios that I'll have for you. So I think as we shift our thoughts a little bit and still continuing with the whole concept of behavioral theories and wanting to change our patients' behavior based on poor choices, today what I wanted to introduce to everyone essentially was the 5A's. The 5A's model, which is an evidence-based assessment and intervention model. The example I'm going to give you is for smoking cessation, but again, you could apply the 5A's for a variety of different health-related risk factors. And essentially, with the 5A's, we use the goal of using 5 components here as an operational heuristic, meaning something as a guide, something as a rule of thumb that will help us walk our patients through a method of changing behavior. And also it's used as a tool to help you communicate effectively with your patients as well. The 5A's essentially stand for assess, advise, agree, assist, and arrange. And we're going to focus on each one of these variables here. And as you can see, this comes from Glasgow and Nutting in 2004. And essentially there's this cycle that our patients will go through that essentially all contribute to their personal action plan, right? List goals in behavioral terms, list strategies to change behavior, specify or follow up with the plan, and share the plan and practice with the team. And the team could be you and your patient. The team could be the patient and their significant other, the patient and their family members, could be the patient and other healthcare providers. So essentially, as we go through these components, again, starting out with assess, we're going to identify risk factors, behaviors, symptoms, attitudes, and preferences unique to that specific patient. And then your job as the practitioner is to advise them specifically how could you tailor or personalize options for this patient over their course of treatment to help decrease their signs and symptoms. Essentially what you want to do is continuously gauge their overall functional component, gauge their quality of life as they're moving through these different stages of the 5A's as well. And then you both come to some agreement, right? You come to some collaborative goals that you're going to set for the patient. And hopefully you as the practitioner is going to help motivate them to change, but also setting these short-term goals are going to help them change as well. For example, smoking cessation. If the patient smokes a pack of cigarette a day, could one of our short-term goals be to... Sorry about that. I think I was here at the component of agree where you're setting short-term goals for your patients. And the example I was going to give, if your patient smokes a pack of cigarettes a day, maybe your short-term goal would be reduce maybe within the next week from a pack, which I don't know, let's say consists of 30 cigarettes, maybe down to 25. Maybe you take it down to 3/4 of a pack. And then you're going to assist them, right, along that journey, provide information, teach them skills, give them other options instead of smoking or having the urge to smoke. Could you collaborate with another practitioner and get them on Chantix or a nicotine gum? And what are you both going to do essentially to help overcome those barriers that do occur that can achieve that goal. And then finally, arrange, right? Have specific dates, times, reminders for the patient when they need to follow up with you. Arrange for benchmarks or milestones when a patient achieves a certain milestone. What's a reward for that? Maybe the patient is not buying cigarettes as much, and that same money that they would typically spend on buying cigarettes a week, they could take that money and buy themselves something as a reward for making these changes. So again, at the end of the day, change is not linear. As we integrate the 5As, patients may go through varying stages of this, may relapse slightly, but again, it's your job to move them through this personal action plan. The phase of the appointment ideally will take anywhere up to about 30 minutes. Introduction of the behavioral theory or introduction of the consultation, 1 to 2. Identifying, clarifying the consultation problem. Conducting an analysis of the problem. Summarizing your understanding as the practitioner. Pointing out possible change plan options, right? So this is where you really need to sell it to the patient and let them know that you're there to help and you're going to guide them through this difficult process. And finally, starting the behavioral change plan. So again, as we move from assess, advise, arrange to assist and arrange. And the rest of the PowerPoint essentially goes through each one of these components. And what I'll do is I'll send this to you and you can have access to this as you try to understand each one of these. So here's an example of asking the patient about weight, nutrition, and exercise. More specifically, this is how do you use the 5As to walk a patient through exercise and nutrition and incorporating both of them into their lifestyle. So again, I've given you the definition and then examples or key phrases how you can engage in the dialogue with your patients as well. All right, the other thing I wanted to show you was I have this handout that I will send everyone as well. And this handout again talks about the 5As, gives you some key phrases, but what I really like about this as well is as you ask, advise, assess, assist, and arrange, and walk through these things with your patients, right? Again, always think about the readiness to change ruler. That's part of the first component of asking your patients if they even want to change a particular health-related behavior. And maybe in your charts, this is this little action strategy implementation, getting some baseline information, is something you all should incorporate as part of your routine paperwork. And then as you go through advise, so this example is for tobacco users, right? The 5As for users to quit. So again, you could advise, strongly urge all tobacco users to quit. Again, what I've done is given you some key phrases, how you can engage in the dialogue. And then assess, right? Determine the patient's willingness to make a quit attempt. Aid the patient in quitting. So what I've done is I've given you some strategies here for that implementation where you set dates, you help them with abstinence, you help them with some medication that you could refer them out for, and then sources maybe within the community that the patients can get access to as well. Again, as we move them through these different phases, we arrange for follow-up visits. And then if the patient is not ready to quit or the patient has attempted to quit, but there's a relapse, then we move into the 5Rs, making it relevant, identifying risks, rewards, roadblocks, and repetition. I'll briefly talk about the 5Rs more on Thursday. What I really want you to do at this point from now until Thursday is try to understand the 5As and how would you role play and go through the 5As with one of your patients. And then finally, I have this little video I want you guys to watch.
When we offer brief intervention, we increase the likelihood that a smoker will quit by around 30%. But what do we mean by brief intervention? Brief intervention, which we sometimes refer to as the 5As, can be defined as an intervention that takes 2 or 3 minutes to apply. We often believe that smokers don't want to quit, and the evidence suggests that maybe 7 out of every 10 smokers are interested in smoking cessation. And we often believe that when we approach smokers at the bedside that we will face hostility or anger. The reality is that we very rarely do. And one very easy way to disarm anybody who may, in fact, respond negatively to that questioning is to ask for permission to discuss smoking cessation. When we do so, we do our first A, we ask, we document status, and we move on to the second A, advise, and we advise that smoking cessation will be the single most effective thing that that individual could do to improve their health both now and in the future. We need to do this both empathically and non-judgmentally. The third A is to assess readiness. A very simple question along the lines of, are you interested in making a quit attempt within the next 30 days? If the answer is yes, we can reasonably say that that smoker is in the preparation stage of change. And we can move on to the fourth A, which is to assist. And we can assist in a variety of ways, but assisting is primarily by offering counselling, medication, or in fact both. Where it may not be appropriate to counsel at the bedside, we can very simply make a fax referral to Quit Now Services. Quit Now Services is a telephone quit line that is available free to all British Columbians. And the final A is to arrange, which may or may not be appropriate in an acute setting. Your involvement for the Hospital Smoking Cessation Pilot Programme is going to be crucial, and we thank you for your involvement. Thank you.
So this video comes from Canada, British Columbia specifically, where this practitioner is introducing the 5 A's in a hospital-based smoking cessation program. And contrary to popular belief, that is not my brother. So, quit lines. We have quit lines all over the country. Texas has its own quit line. Pretty much every state has a quit line, and I'll give you those references in the class as well. The last thing I want to do, hopefully I have enough time, is just give you an example of how to use the 5 A's in practice.
So I'm going to prescribe some antibiotics for you. I think the cough and phlegm is a lung infection. And within a few days of taking these antibiotics, you should feel considerably better. Now, I'm hoping that we can talk about smoking today. That's something you'd be comfortable to talk about?
Okay, sure.
How many cigarettes are you smoking per day right now?
I've cut down, I think, because of just not feeling well, so probably about 15 to 20 cigarettes.
Right. And it's been many years.
Gosh, about 20 years, yeah, a long time.
And you understand that quitting smoking will be the most effective thing that you could do to improve your health right now, particularly in the context of these lung infections. I think this is the third one we've treated this year.
Yeah, it's just, I've tried in the past, and I just get so cranky and angry and frustrated, and it makes it really hard to continue.
Right, so you found it tough. Is quitting smoking in the next 30 days something that is realistic for you?
Wow, I hadn't really thought about it, but I suppose I could. I could give it a try.
And you mentioned being cranky and irritable. Those withdrawal symptoms are really common, and there are ways in which we can help you to manage those withdrawal symptoms. Certainly the medications, of which we have a number of options, will minimize or eliminate the withdrawal symptoms. We have a number of nicotine replacement therapies, patch, gum, lozenge, and inhaler. And we also have 2 prescription medications, varenicline and bupropion, all of which are effective, and all of which will mitigate those withdrawal symptoms. And then we have a number of counselling options as well. So we can provide you with some one-to-one support within the clinic, or we can refer you to a smoking cessation group. And then you have the option of using the telephone quit line, Quit Now Services. So I can just simply do a fax referral to the Quit Now service,
Wow.
and they will contact you and set up a system of support to support you through a quit attempt.
I didn't know that they offered things like that. So, yeah, I would definitely want some more support. That would be really helpful.
So we could certainly set up the quit line for you. What about medication? Does that interest you?
People say that the patch is really helpful, so that's something that I might be willing to consider.
The patch is a good option. It's been around a long time. It's safe. it at least doubles the likelihood of you being quit at 6 months after your quit attempt. So